Well, I should probably start by saying that colon cancer is a disease that is very treatable, primarily through surgery. That is, for many people, in fact, I would even say the vast majority of people who develop this disease, a complete cure can be achieved solely thanks to a properly performed operation. In this procedure, the affected part of the intestine is removed along with the tumor. Not only the intestine is removed, but also the mesentery, which contains lymph nodes that may have tumor metastases. Thanks to this, the tumor tissue is completely removed from the body. And many of these patients don't even need additional chemotherapy or radiation therapy. Now, regarding the steps to take when someone is diagnosed with colon cancer. Most often, a person complains about one of these symptoms, digestive issues, blood in the stool, and they go, for example, to a gastroenterologist. When faced with such suspicious symptoms, the gastroenterologist usually orders a colonoscopy. And the endoscopist, the doctor who performs the colonoscopy, is usually one of the first specialists to detect colon cancer in a patient. What should be done next? If the endoscopist is knowledgeable and experienced, then in 90% of cases they can identify colon cancer just by its external signs, by how the tumor looks. But the final diagnosis is always made only based on the results of a biopsy, when a small piece is taken from the tumor and examined under a microscope by a pathologist, and then the definitive diagnosis is established. Most often, colon cancer is an adenocarcinoma. This is a specific type of tumor that develops from a certain type of cells in the inner lining of the colon. And after a person receives a diagnosis of colon adenocarcinoma, they need to see an oncologist, who is the specialist that actually confirms this disease, records the diagnosis in the patient's medical documents, and is required to report any newly detected cancer case using a special form to the Federal Cancer Registry. This is one of the main responsibilities of an oncologist. The second responsibility is to refer the person for specialized treatment. In order to determine the course of action for treating this disease, an oncology board, tumor board, must be held. This is because colorectal cancer is a disease that involves different specialists. First and foremost, these are surgeons, but they are often assisted by chemotherapy and radiation therapy specialists. And to properly plan the treatment, it is also necessary to involve radiology specialists. Because the most important and primary diagnostic methods for colon cancer are computed tomography, magnetic resonance imaging, and some other examination methods. Thanks to these methods, it is possible to determine the stage of the disease and select the most effective treatment. However, most often, going through these stages, from initial diagnosis to seeing a specialist, can take a long time. And, since nowadays there are ways to get information, for example, from the internet and various other sources, patients, of course, don't wait those few days after they receive a preliminary suggestion from the endoscopist that they might have colon cancer. They want to find out what this disease is. And, in fact, that's why you're watching this video right now. And what actions need to be taken. And sometimes it actually makes sense to undergo further examinations even when the endoscopist has already identified a colon tumor, but the biopsy results haven't come back yet. Because getting the biopsy results usually takes several days, up to 2 weeks. And during those 2 weeks, you can get a CT scan and an MRI of the pelvis if we're talking about rectal cancer. This significantly speeds up the process of getting all the diagnostic tests and their results, allows you to determine the stage of the disease, and helps select the most effective treatment.